Hi, my name's Jenny and I'm the clinical lead for Healthy Bones, where we perform scans looking for osteoporosis. So during COVID, when the first lockdown happened, we decided to suspend our services as we weren't an essential scanning service. So as we weren't able to scan any of our patients, we thought, how can we help our patients? What can we do in the meantime whilst we're not able to physically see these patients? And this is where we developed a telephone triage system where we have been able to speak to our patients and to perform a bone health review with them. So this has enabled our patients that are at highest fracture risk to be able to get access for treatment.
Hi, my name's Lynn Lloyd. I live in Plymouth. I have got problems with my joints with one thing and another. I've been having a lot of steroids in the last couple of years, so we just want to check out my bones. You go in and you sit on the edge of the bed, and then you put your feet across, and then you lie down, and it's just a humming noise that just goes over your body. No pain, no nothing. You're not enclosed. The radiography, she had explained everything what was going on, each step. Very good. She explained everything what she was doing. I'll get the results between 2 to 3 weeks to my consultant at the chest clinic. Just wait and see what the outcome will be.
If patients aren't sent to us, if they're at risk of osteoporosis, of having fractures, then they're at risk then of more fractures. And obviously the more fractures you have, it causes pain, it can cause lifelong changes if they've had spinal fractures, you fractured your hip. If you're if you're elderly and you have a hip fracture, that can be, that can change your, those last years of your life. That can completely change that depending on what your health is like. So if we can reach those patients before they reach that point and help them and treat them if appropriate, then that can have an impact on the patient's life, on the hospital as a whole, as in that patient then wouldn't need to come in because they've had a fracture and have surgery, etc., and they stay in the hospital. But the main reason is for patients. You think that the pain and the immobility that it causes with those fractures, that's what we would like to do. We want to reduce this happening in the community.